Dr. Dennis Ciccone here at Ciccone Family Chiropractic and Wellness Center. I wanted to answer another question today, which is why do we go in the specific order we go through for our testing? So this is a very important question. I developed this process through years of studying, training with other doctors, and going through the process, and it is what makes the most sense to me, and I'm going to explain that to you today. So the reason we start with a food test first is the biggest factor that you can start to control when working on your body is the food that you're putting into your body. So we want to minimize what those risks are, allow your body to start healing because we're not making as much damage. When you look at our 4-phase approach, we start with the gut. That's the first area we start to work through. And the reason we start with the gut in a bigger picture is the gut is where all of that food is absorbed. It's where your nutrients go into your blood. The immune system sits there, a large part of the immune system, as well as neurotransmitters are made there. So serotonin, which helps to affect your mood, and again, absorption occurs there. So if you're taking in a lot of supplements, if you're struggling, if you have leaky gut, if there's an infection in there, all of these things are going to be triggers that cause things like leaky brain, trouble thinking, brain fog, inflammation throughout the entire body, irritation in the gut, bloating, weight gain, irritation, fatigue, all of these other symptoms. The first place you want to look is the gut. You want to look at the digestive system, make sure that's cleared up. So that's why we do the food test first, and we start minimizing the risk by stopping to put those things in. The other thing we do is we start giving you some specific herbs to start healing the body. Some specific things like helping with the mucous membrane, helping with digestion, helping with bowel movements, helping with decreasing overall inflammation. So that's the basic first step. The second test that we go over is the stool test. And the reason the stool test is so important is, one, it lets me know if you're absorbing your nutrients right, are you breaking down your foods properly, but most importantly, it lets me know about the immune system. It lets me know your good bacterial profile as well as your bad. It lets me see if there's any yeast, any parasites, any dysbiotic bacteria in there that are not supposed to be in there. And then the test goes even further and grows those in a lab and tells us exactly what natural treatments will kill it as well as pharmaceuticals. The majority of our patients, they're looking to do natural treatments. So that is the first route we go. And we want to make sure that these infections are killed, because if we're moving on to the next steps where we're pushing toxins or working on other processes and those infections are still there and the gut's not healed yet, those things can be pushed into the bloodstream. They can create tremendous stress down the road. So we always want to work with the gut. And again, I want you to think of the leaky gut as kind of these holes in between my fingers. Ideally, the gut should be nice and sealed. If it's like this, there's things that can get in there and get into the bloodstream, and that's not supposed to happen. So we want to make sure the gut is healed. We want to make sure that those bacteria are killed. And then we want to look at that healthy bacteria. We can see exactly which strains are weak, and we can start to build that up. We can also get a lot of information from those bacteria if they're depleted, whether it's likely that there's been mold exposure or Lyme or other types of things. So there's a lot of information that comes to me on that stool test, as well as, more importantly, the specifics of how to move that in the right direction. Remember, when you go through a process with us, we're not trying to treat your symptoms or your disease. We're looking at these things and how they're affecting how you function. So we want to make sure your gut and your digestive functions are as good as possible. That's step one. And that's what those two tests really help us with. The second thing we then move to, once we know that the gut has responded and it's moving in the right direction, is then we move towards a detox. We want to make sure that the liver is working properly, and we want to make sure that those toxins are released. The thing I want you to think about is two things. Hormones, many of them are converted to their active form in the liver. So if the liver is sluggish, hasn't been taken care of for a long time, it's not going to be doing what it's supposed to be doing. Okay, so we need to make sure that that's functioning, again, as well as possible. The other thing is your liver is your main backup system for detoxification processes. So just like they check the filters in your car or you change your central air duct filters, that is your liver. That is the part of your body that's doing this. And you can't just change the filter. There's certain things you need to do to make sure this is functioning properly. So most of my patients, they've never went through a doctor-guided detox process. So that's what we do with our patients. Again, it's not cookie cutter. It's specific to you, and we're going to take you through a 30-day process to make sure that that's functioning as well as possible. The other thing that's important is that when toxins store inside of your body, if they can't get out, what the body will do is they will store those toxins inside of fat. So many patients that have high toxicity levels also have trouble losing weight. And as we get those toxins out, and again, out the body, because now we've healed the gut, so we can get them out of the body instead of recirculating back into the bloodstream and back to the liver, which is just a frustrating process. And makes the patient feel really sick. By going in this direction, now those toxins can get out. The body doesn't need to hold that fat anymore. Once we get through the detox, and now the gut is healed and the liver's functioning well, that's when we do our next test, which is the hormone testing. And we use that testing to help see how well your hormones are functioning. But also there's certain markers on that test which lets me know how effective your detox was. Do we need to do another 10-day detox? Did we get everything out? What do we need to do from that standpoint? So this, again, is the reason we go in this order. And I want you to think of hormones now. I want you to think of hormones as the money that you use to pay your bills. So if your inflammation is high in your gut, if there's infections, if there's toxicity, if there's inflammation, if there's swelling, if there's parasites, yeast, leaky gut, all of these things are not functioning properly. All of these things draw on those hormones. So the reason we don't do the hormone testing first, many people ask me this, is because from my standpoint, I want to save you money. I already know your hormones are low. Most of you know that at that point too. So just to spend money on a test to prove that, I would rather systematically decrease the reasons that your hormones would be low first, help the body to be able to regulate that normally, and then we can get a really good reading of where they are once they're supported. From there, then we can start building those hormones and make sure they're doing everything properly. The other thing that's really helpful about the Dutch test is it will actually pinpoint to me the environment that predisposes you to cancers. So I can actually look at the ratios, how your body is metabolizing those hormones, and from that standpoint, I can now look at it and say, not that you have cancer, but that your environment in your body is actually in a position to be growing those cancer cells. And then we can actually look at how much DNA damage there is as well on that test. So again, I hope this gave you a good understanding of why we go through the tests in this way, give you a better understanding of what to look forward to as you go through the process. And again, know that these tests are actually going to let us know how well that you're doing on previous parts of the program. So again, it should be exciting. It keeps us accountable, keeps us moving in the right direction, but it also helps to make sure that we're not missing anything. So that's why testing is so important. It saves you from banging your head against things. It actually makes my job pretty unfair in the sense I know exactly what we need to do to move you in the right direction. Now it's up to you to do those things as we move through the process. So again, excited to continue to work with you. I hope that gives you a better understanding of the testing, and look forward to talking soon. Have a wonderful day.